Hi there. If you're watching this, it's because you are interested in AC separation surgery. Maybe you have an AC joint injury, or maybe you're just my friend, making me feel good about watching my YouTube video. Anyways, I'm about 28 hours out after having surgery on my left AC joint. I had a grade 5 separation. They made an incision basically from about the middle of my clavicle over the other side. And drilled 2 holes into the clavicle, threaded it through with Kevlar thread, and pulled the bone back into place. And then over the course of the next few months, theoretically the tendons will be growing up along the Kevlar, and I will have a joint that is bulletproof, better than new. But anyways, I just wanted to share some information that I had gleaned over the past few weeks of having this injury. It occurred when I was riding my bike, gearing up for cyclocross season. I race bikes, I race cyclocross, and I just misjudged a curb, went to hop it, dumped over the handlebars, and landed in just the wrong spot, and had a trip to the emergency room immediately. Immediately knew something was wrong. Felt like vomiting, saw white. Very fortunate. I fell in front of a guy's house. The guy came out of his house and just drove me straight to the ER. I was 2 miles away. Basically spent a few weeks trying to find the right specialist to give me the right information, and for my lifestyle and the activities that I like to do, I decided it was going to be pretty critical that I have the surgery. Grade 3 is kind of a gray area. Grade 4, your clavicle will have shifted back. The pain will be insane. Grade 5 is when, from what I've been told, the angle is over 200%. That your clavicle has moved essentially 200% into the wrong position, and then you can choose to try and correct it by elevating and still dealing with a little nausea, elevating and immobilizing for 4 weeks and seeing how that goes. And if it doesn't go into place, then you have to have a full reconstruction, or the route that I took was just immediately having surgery. So my procedure was pretty straightforward. I had a 7:30 a.m. surgery, so just stopped eating at midnight the night before. Had my lovely girlfriend drive me to the hospital. They gave me a nerve block, which was pretty awesome. It took care of numbing all of this, so I was able to have a lighter dose of general anesthesia, so I was able to be a little bit more cogent and kind of have a faster cognitive recovery after the operation, which was nice because I was able to get up, walk around. We were able to come back home where I could just crash out, take a nap, and relax. A few tips that I picked up just in the last day or so. One, sleeping is going to be a challenge, so you're not going to want to lay flat on your back. I have a nice setup on my couch where I'm essentially laying across the couch, and I set up some pillows on the armchair so that I can sit up when I sleep. A lot of people opt for a recliner. That's out there as well. I just wasn't in the budget. The nerve block, again, highly recommend. Be careful with it though. You're going to think that you're in much better condition than you are because your arm and shoulder are completely numb. So start medicating pretty much right when you get home. That's what I did. I started a low dose of my medication, and then by the time that the nerve block had worn off, I had a nice kind of cushion of hydrocodone and didn't feel it too much. The pain is there. It feels not nearly as bad as the initial injury, but you'll notice if you're just not on it, it'll be real subtle at first, and then all of a sudden it'll be pretty excruciating. So on that note, I set a timer on my phone, just an alarm to go off every time I'm supposed to take medication, and that way it's just the ball's out of my hands. It's just, hear the alarm, go get your medication, take care of it. Stool softener. Having a movement is going to be really hard for the first couple of days, especially because you're on all the pain medication. So highly recommend picking up some of this or asking your doctor for something. And it's subtle, but man, just quality of life, significant. I have the Cadillac of slings. It's got a really nice pad up here. It's also got a great little block right there, so that the basically keeps it off of your stomach. It's got this fun little squishy ball, so that you can do exercises and stuff like that. Yeah, and that's been my first basically 28-30 hours post surgery. I'll be posting over the course of the week and throughout my recovery. So if you're experiencing something like this, good luck to you. Those are my recommendations for the first day. And also just take care of yourself, relax, and don't try and get too much done. Try and take this time to reflect on some things that you may be neglecting, like sitting on your couch. Okay,